Good evening, everybody. Welcome to October 4th, our first installment this month of our Evenings with Dr. Prasad. This is our Ask Dr. Prasad evening. It's the first Wednesday of every month. I'm excited for you to be here. Thank you for those of you that were patient as we were getting ready to open up tonight. We had an extra layer of security that we needed to go through in order to log into the Zoom meeting that we had tonight. Many of you participated in the emergency broadcast system, the notice that went out the whole countrywide today. And we're just grateful that we have already over 60 people that are here with us for our Ask Dr. Prasad evening. As we get underway tonight, I need to make sure that we are protected from a legal standpoint. So please follow along with me. I'm going to pull up onto the screen these words of the disclaimer. I know that we have added to these words. I'm just here on my laptop tonight. So as I pull these words up, just follow along with me. These statements and comments have not been evaluated by the Food and Drug Administration. The information is for educational purposes only and includes recent advances in research on micronutrients. Engage, the micronutrient company, does not claim that our products diagnose, treat, cure, heal, or prevent any disease or injury. Engage's products do, however, address our deficiencies and provide our bodies with the nutrition that we are lacking. And to go on here, nothing that is said tonight is intended to be a substitute for treatment or a visit to your primary healthcare provider. And so that having been stated and displayed there on your screens, we are free to move forward. This is our first installment for October of our special evenings here with Dr. Kedar Prasad, the world's foremost expert on micronutrition and supplementation. Before I pull Dr. Prasad up, I want to just share with you quickly, this is the science booklet that we have, and those of you that are following along here tonight, I want to draw particular attention to this page right here. This is our timeline of when this information went out to the world, but there is the man behind MicroDaily. He is the professor at University of Colorado School of Medicine for 30 plus years as director of vitamins and cancer research, former president of the International Society of Cancer and Nutrition. You can see down there through all of his credentials and his accolades. World's first radiation biologist, PhD, back in 1963. The reason that I am bringing up this is because as prolific as Dr. Prasad is, and the number of publications that he has that has his name to it, he is not a medical doctor. And so tonight's Ask Dr. Prasad, here are just some of Dr. Prasad's books. And it's amazing that we have access to him here in this capacity as we move forward with our evening of spending time with the world's foremost expert on micronutrition and supplementation, Dr. Kedar Prasad. And I am going to pull Dr. Prasad up here onto the screen here with me. And as we are underway here tonight, thank you once again, Dr. Prasad, for your patience. And it was nice to get a call as we're a couple minutes late starting tonight, and you wanted to just make sure that you were in the right place at the right time. And you were. It's just we had another layer of security, and couldn't get logged in. But it's exciting to see that just as I have been describing and explaining these things, we've added, now we're over 70 people that are on here with us tonight.
Yeah.
So as we set the stage, and I started to do this, Dr. Prasad, you're not a medical doctor, and you're not here in a capacity of answering a bunch of medical questions. You're here to answer questions about these products and your understanding of the human body. And as we correct these micronutrient deficiencies, those responses that our bodies can give us. And it's amazing. You spoke about it just here again last night when we were talking in the Optimal Longevity series with Dr. Court and Jonette, the biochemist. We were referencing part of your core 4 products, and that is the new patent that has just been issued on our collagen product. And
Right.
collagen is a multi-billion-dollar industry. And to think that your formulation was so unique and so specific as to what it can do, that it is worthy of and has received a patent is amazing, along with a lot of other patents that have your name at the top of it.
Yep.
And those are patents that have been issued already, and they go back as far as the ones that we've been tracking, as far as 2008, 2009, 2012. And so there's quite a bit of just your life that has gone into making sure we're all healthy. So
Yes.
what we're going to do tonight, this is our Ask Dr. Prasad format. And I'm grateful that we have Dr. Percola Roberts on here as my co-host. She's letting people in from the waiting room. She's also going to help me monitor the chat. But if we can have people begin to raise their hands, their digital hands, you go down to the bottom of the page of your screen, whether it's on your laptop or on a desktop or even on your phone. We can see that we've got Marie Houston and Fulvia and Sharon that have already raised their hands. And so we're going to go to them. If it's possible, ladies and gentlemen, and you can turn your cameras on. I know that Dr. Prasad, like myself, likes to see who's asking the questions and address those as directly as we can. But if it's possible, we'd love to hear from you and see you. But if not, just open up your microphones. We are going to start with Miss Marie Houston, and I know Marie is out of Cincinnati, Ohio. And so, Marie, what is your question for Dr. Prasad here on this incredible Wednesday night? So go ahead, Marie, you're first.
Okay. Good evening, everyone. Jeff, Dr. Prasad.
Yes.
I just wanted to ask the question about a sister of mine's, Alice Barnett. She is on this call, and she's been on the product since November of 2022. And she had suffered a stroke, I believe she said it was in August of 22. And in past years, she's had hip replacement, knee replacements, and a shoulder replacement. She said they call her the bionic woman. She's like 83 years old at this time. And she started off with the EMF capsules, and she switched over to the hydro. Now she's taken 3 of those hydros a day. So that's like 9, and the probiotic and also the collagen. And she just don't seem to think that she's getting the results that she should. And her left knee is swollen, and her thigh, leg, and she says there's some like skin irritation developing, little bumps or something, and itching. And I just want to know, what we're doing wrong, because she's been on them and religiously taking the products. She does have, her doctor had mentioned something about her heart the last time that she was out. And then that left knee has no cartilage in it. So she was wondering, is there more that she can do, or if we're doing something wrong?
Well, first, I don't know who suggested you to take 3 hydro in the morning, 3 noontime, 3 night. That kind of dose, I recommend only those people who have a cancer in consultation with their oncologist. So first problem is for me is that gradually, I would say you reduce the dose to a 1 in the morning, 1 noontime, and 1 in the evening. That's 1. You are taking a probiotics with prebiotics, which is very important. And then also, since you have all this kind of issue, collagen peptide is very important. I don't know whether you are taking collagen peptides or not. And
Yes.
and also it is now we have a new omega-3 fatty acid, which is absolutely essential for your health. And also we developed recently digestive enzymes because older people have a problem with digestions. And so if your intestine is not very happy, your rest of the body is not going to be very happy. So I would add a digestive enzyme, which you take 10, 15 minutes before your meal, and then follow that schedule for for a month, and let us know next month how you feel.
Okay. Now I'll be honest. I did mention it to Jeff. He remembers, and he did say to reduce it. And she's started reducing where she don't take 9 a day. She's taking like 2 packs a day. But you're saying that she should do 1 pack in the morning maybe, and then 1 pack later?
Yeah, and one in the evening, 3 times. Yeah.
Okay. Oh, 3 times?
3 times or twice. Twice will be as good.
Yeah.
Because
Just like
1 pack equals 3 capsules, right?
Yeah.
Since she has a lot of health issue, I would suggest 3 times.
3 times. Well, I think that's what she's doing.
But you were taking it 3. I mean,
yeah,
taking
three doses, Marie. So 1 of the stick packs in the morning, 1 in the afternoon, and 1 in the evening.
Right.
Is
And
Well,
then once you do that, then let us know next month meeting.
yeah,
how
and
you're doing.
if you'd like to get her on a 3-way phone call with me, we can explore some other things that are going on as well. You mentioned the rashes and some of those things.
Yeah.
I got some possibilities that way, but it's going to be really more of a conversation that you and I can have with her. But what Dr. Prasad has suggested tonight, yeah, we don't need to be overdosing.
Yeah, digestive enzyme is very important for her because of the age.
I got you.
Wonderful.
Okay.
Well,
She is on the line. I didn't know if you wanted to speak with her or not,
No.
but
Yeah,
we'll get together, Jeff.
let's do it when we can spend some more time with her.
Gotcha.
All right.
Thank you.
Thanks, Marie. That's a great questions.
All righty.
So, okay, Phobia. Oh, look, Phobia's even going to turn her camera on here for us. There she is.
Hello, everyone.
Hi, Phobia.
My question is, well, a customer, a potential customer is, she has cancer. She is stating that her doctor says she cannot take it because the EMF has vitamin B.
Well, vitamin B had nothing to do with the cancer, but the most important thing for this thing is we have to follow oncology advice. I'm just based on research and somewhat what we are available in research data. I suggest that any person who has a cancer and take a 3 capsule in the morning, 3 in the evening, and 3 in the noontime. So 3 times.
Okay.
And the reason is because high doses of antioxidant has been shown in experimental system. It can kill cancer cell, but not normal cell. And also, if you are getting a chemotherapy or radiation therapy, it will enhance their effectiveness or killing effect on cancer cell, but not on normal cell. But again, you have to consult with the oncologist. And if oncologist has any question about this, I can provide him with further information. But these are all based on experiment. There is no human data available like a clinical study on this issue.
And how can he reach you?
Well, he can reach through my email or telephone number.
I don't know neither one. Could you share that?
So, Phobia, we can just take care of that afterwards. You've got my information, and we'll make.
Okay, thank you.
Yeah.
Okay, thanks so much.
Awesome.
Sure.
Very good questions. Thanks for being on here tonight. All righty. So Sharon's S21. You're next, and then it looks like we've got Van, Ed, and Joyce Howard. And Ed and Joyce were with us down in Cancun.
A lot of people today.
Yeah, exactly. So Sharon, you're next. Go ahead.
I have an autoimmune disease, sarcoidosis for decades, and I was on steroid dependence. as well as arthritis. So I went off of that around about 3 months ago. But of course, I've been taking the products for over a year, and the new products, except for the digestion that just came about. But I still suffer, I don't have the high pain level that I would have if I move and do stuff and start the inflammation going. But I still have, the pain and the joint stiffness and like crystallizing, like my body would get crystals in it. And so I'm just trying to figure out what other solution should I take? Because, like I said, I was on prednisone and I think Plaxenil, I think what that was. But, I went off of that. So I just want some suggestions, please.
Yeah, I think Dr. Piccola has a similar situation, sarcoidosis. Isn't it, Dr. Piccola?
Yes.
Yes, yes, sir. I had sarcoidosis and was diagnosed with it at the age of 19, and understand exactly what you're talking about, Sharon. The thing that I did and have been so helpful for me is coming to the conclusion that I needed to use only Dr. Prasad's formula. That was the most difficult thing for me because I was using everything that I could throw at the sink to ensure that I would feel better. And I want you to know that I am absolutely doing so much better. And I don't have any of the joint pains. For real, I don't. The collagen works miracles for me. And now that Dr. Prasad just came out, the omega-3 I've always utilized the omegas. And the omega, and I keep saying 3, Dr. Prasad, and you keep shaking your head, but I'm sorry, that's what I've had down through the years. Now I'm doing the omega daily, and it is helping as well. Sharon, the one thing that I had to do was be patient with my body and recognize how severe sarcoidosis is. Now, there's a sarcoidosis foundation also that you and I can talk about later on that is getting ready to have a summit that gives a lot of information. But it is pharmaceutical, very heavy. And for me, pharmaceuticals did not do me well at all. And the good thing that you have said to me is you came off of prednisones. Prednisones will absolutely melt your bones. And so being that I've taken them for so long, it's taken a long time to rebuild the strength in my bones. And believe it or not, I was going to ask Dr. Prasad tonight, once the bones have been absolutely affected by taking these steroids, can we really rebuild the marrow in our bones? Can we, what does it mean when you say we can strengthen them? Can we get them back to the place where they used to be, where we not have to concern ourselves about breaks anymore? So Sharon, these are questions that I know that you would have as well.
Yeah, I think this is a very good question. One thing is that, collagen peptide will do something good for restoring bone minerals. But I think it is important for bone, especially for the woman, because of loss of estrogen, that you take also calcium supplement with magnesium. And generally, my wife takes 1,000 milligram of calcium and 500 milligram of magnesium citrate. And that you can buy in any place. Calcium in citrate form is absorbed more quickly, and magnesium, whenever you are using a calcium, half of them has to be magnesium to balance out. So I would suggest that take a extra. We don't have that product because many people don't have the same issue. And so I would suggest for both of you and for other lady, that you take 1,000 milligram of calcium citrate combination with a 500 mil. They come in a tablet form both together.
Yeah, they do.
500 milligram of magnesium citrate.
This one doesn't allow me. Oh, is he still talking?
Well, I didn't get the question.
Go ahead, Sharon. Your question?
No, that was I think that's Joyce talking. I wasn't talking anymore. I was just
Oh,
listening.
okay.
I think that's Joyce.
Okay.
Oh, okay.
Joyce and Paige,
Well,
I think that's talking.
I'm sorry, Jeff. I was out. I'm not in the back. Make Bernard, make
Yeah,
him
it's
co-host as
So,
well.
so the question is, whatever you are doing for code 4 and digestive enzyme, you take it and plus this the calcium and magnesium additional that we don't have in our product don't have it. So you buy it any health food store, you can buy it. That's the only additional thing I would suggest.
Okay. Sharon, if you would give me a call, I'll put my number in the chat for you specifically to give me a call so that we can talk further about this, because it is a disease that for real can make you feel so alone in working with it. And I have been working with it and I'm doing very well I'm doing very well since I have started with Dr. Prasad's program. And the thing is, I had to be patient with my body.
Yeah, well, I was on it for I started when I was like 19, round about like you. And I had gone all the way up to like 60 milligrams because I had gotten neurosarcoidosis. It went to my brain.
Oh
so,
my God.
Yeah, I experienced with that.
Yeah. So you absolutely will need
and also, remember that the effect of micronutrient deficiencies is slow. It is not like any other, prescription drug that if you have a headache,
that will have. Yeah,
it is quick. It is slow progress. So you have to
is.
give them a 90 days time before you observe whether it is working for you or not.
We'll get together, Sharon. We have about 10 other people.
Yeah, I think.
Thank you so much. I appreciate it. Thank you.
Okay, please call me.
Thank you, Dr. Roberts, for stepping in and helping us with that answer. It's always best when you have somebody that's been there, done that.
Exactly, same thing. Yeah.
Yep. Well, thank you, and I appreciate you being co-host tonight. And we've also got Bernard Dean that's helping us out as well, because we've got so many, almost 100 people that are here with us right now. So thank you, Dr. Roberts. All right, moving on. It looks like we've got Van. Your phone is you're the next one in line, and right after that, Ed and Joyce Howard, and then Bruce Seaman. So go ahead, Van. Your question for Dr. Prasad.
Thank you so much, Brother Jeff. And normally when I'm on Zoom, it says winwith.net is my name. But since I'm on a phone, it's because today we took pause about the 5G. So I've downgraded my phone to a 4G, an older model, which Zoom doesn't actually work on these phones. So if any of you guys were a little bit taking pause today about that 5G, understand if you don't want to downgrade your phone, just get the military micronutrient EMF formula. It's the only thing that Dr. Prasad has created on this earth to protect us from the inside from this scary radiation and EMF. So my question for Dr. Prasad, first off, shukriya for always teaching us, Dr. Prasad. We appreciate you so much. I have 3 questions, and I'm going to let you choose, Dr. Prasad.
Just one.
Just
one. Just ask one.
I know. I'm going to let
just
Dr.
one.
Prasad choose.
No, so, just one quickly, Van. We've got 5 more people.
Well, I want him to pick out of the 3. Then he can answer the
one question, Van. Go ahead. One question.
Van, you can always.
Dr. Prasad. A stem cell question, a question about kidney stones, or a question about graying hair. Which one would you like to answer?
Either one, you decided.
All right, I'll decide on the graying hair because that's personal. The stem cells is for another soldier, and the kidney stones is for another soldier. So on my personal level, I have seen some graying hairs, and I know when I first met you in 2021, you had a little bit more gray than you do now.
Yeah.
What microdaily product would you suggest to possibly, not guaranteed, but possibly bring the color back to our hair that's starting to turn a little salt and pepper?
Not only salt and pepper, I don't think, that is a graying, because anytime you have oxidative stress, that kills the melanin cells, which makes you darker hair. But slow down the progress. That's all the best you can do, like my hair. You can see many people at my age have 100% white, but still I have a lot of dark hair. But one thing that people lose hair that is more concerning then the graying of the hair is the loss of hair. And biotin is the one way you can prevent the loss of hair. And from the diet, you may not get sufficient amount. We have some biotin in our formula, but that may not be enough. So if you want to preserve or reduce the rate of the loss of hair, I would say take an additional amount of biotin that you can buy.
And biotin is found in the micro daily formulation, correct?
There is a small amount is there because, you know, not everybody is needed for that, because that's developed for all ages. But if you, as you grow older, you have tendencies to lose hair. So I take some additional supplement of it is very non-toxic. And the only place that you, in a food that you have biotin is a white portion of the egg has a biotin. But
okay. That's amazing information. And I just kind of triple up on my micro daily, and I've had no problem with losing hair. I have long hair down to my down past my neck now, and a very full beard.
That's good. But for example, myself and my wife and my son is very young, but he got convinced that he should take some biotin because, you know, as you grow older, they start losing hair. That's one of the problems. But maybe I have genetics. But anyway, I take some.
Yeah, micro daily has given me plenty of hair. I just want to make it look as dark as yours again. So thank you so much, Dr. Prasad. Shukriya, and thank you, Brother Jeff, for hosting this call.
Thanks, man.
Thank
you.
All
right,
Dr. Prasad. Have a good night.
Bet. Good night. All right, Ed Howard, Ed and Joyce there in the background. I'm going to pull you up here onto the screen with us tonight. It's exciting to see you guys again. Yeah. Last time we were together, it was down in Cancun, Mexico.
So Cancun, I know we had very pleasant talk for a long time.
So go ahead, your question.
Nice to be with 2D. I had a question. We just recently got notice of a friend that has cancer, 25-year-old woman, and she has a brain tumor, and they're thinking of operating and doing a biopsy beforehand. Sometimes when you do biopsy, according to some doctors say that it will, you know, have more of a chance to metastatize. But as far as supporting that in her treatment, when she gets emotional, she has seizures. It's just every time she has an emotion, she'll have a seizure. So I wondered if Dr. Prasad might comment on that as far as what we might help her with.
What kind of tumor he has in brain tumor? Do you know what kind?
They haven't done the biopsy yet, but they want to operate.
For example, the EPTJ benign tumor, like, you know, schwannoma or some other one, but EPTJ neuroblastoma, as you very know. And my son, at the age of 32, he has neuroblastoma. Once you have neuroblastoma, nothing you can do. The average lifespan is 14 to 18 months. And no matter what treatment you do, but glioblastoma, sorry, not neuroblastoma. It is, my wife reminded me, I used to work with neuroblastoma. It is a glioblastoma tumor. And so if it is a glioblastoma tumor, the best thing you can do, provide a good quality of life as long as you can. Because high dose of antioxidant, no matter how much you give, it would not go enough level in the brain to affect the growth of the glioblastoma. And as you know, many people that I know who had this kind of problem, and they can make it. But by giving appropriate macronutrient and diet, you can improve the quality of life as long as he lives. That should be the main aim. But doing so, if some miracle happens, you know, if you are taking a macronutrient, your immune system is functioning well, it can kill tumor cell, who knows? But I would not give a false hope to increase in time. If it's a glioblastoma, the best strategy would be give her appropriate macronutrient like we have, and you know, add all, the core 4 and digestive enzyme, and then hope for the best.
Yeah. So you would suggest like 3 times
Yeah,
the normal dose, something like
that's
that?
the normal dose. You don't have to have
Oh,
3
just
times.
normal. Okay.
Because it
Okay,
is
well,
here the important thing is to stimulate the immune function, and
yes.
so that there is a chance that it might kill it. Who knows? We don't know. I can't do anything, but
Yeah.
no matter how much you give orally, it is not going to be enough in the brain to kill glioblastoma. Now, if it is other type of tumor, surgically they remove, and then you can just give them the way you are doing it. And I had a friend in Denver who did not have glioblastoma, but he had some kind of brain tumor, and surgically it was removed because it was a removable area. But see, glioblastoma is in such area, you can't remove it totally because that will affect the cognitive function, all kind of neurological issues. So it is terrible disease. And so the best thing for him or her would be to provide a good quality of life. Once you know, let me know what kind of tumor was, then maybe I can further advise.
Great. Thank you very much.
Sure.
We don't have much information because we just got the information from Bolivia, but
Yeah.
we'll get on it and we'll get you the information. Thank you so much.
Sure, Ed.
Appreciate it.
All
Nice
right.
to talk with you.
Take care, Ed. Thanks. Good to see both of you.
Both
All
of you.
right. Super. So we're going to go to Bruce Siemens, and then right after Bruce, Dr. Roberts has identified a question and a comment out of the chat. And so we're going to pull her up. So Bruce Siemens out of Idaho, you're next.
Yes.
Go ahead, Bruce.
I've been there.
Yes, you've been to, there we go. Okay, so you're going to need to open up your microphone, Bruce. We saw your camera there for just a moment, but you're going to need to unmute your line. Go ahead, Bruce. You'll need to unmute yourself. That's down in the lower left-hand corner of your screen. It looks like a little microphone. Click on it and it'll take off. There we go. Go ahead, Bruce. Your question for Dr. Prasad. It's really difficult to hear you, Bruce. Bruce, we're getting all kinds of static. Bruce, it's just a bunch of static. Bruce, it's just a whole bunch of static. We can see your picture now, but something's wrong with your microphone. We're not hearing you.
Yeah, his question is,
Yeah.
he's got a customer who gets dizzy all the time, and she's wondering what would help with the dizziness.
Okay, so this is coming through Bruce's sponsor. So Bud and Cara Marie are asking Dr. Prasad, well, what about dizziness? Somebody who gets dizzy all the time. What would you suggest?
Yeah, dizziness is one of the symptoms of a traumatic brain injury that we did on a veterans. Dizziness and balancing problem was there. So I would suggest that take him, micro daily EMF. How old? If he's an older person, I presume, and then take code 4 and digestive enzyme. Those are the things we suggest. And I think if if you can't
tell them dizziness and balance.
Yeah, balance. Yeah, that's the characteristic of a concussive injury or traumatic brain injury. They are associated dizziness and balancing problem. And at that time, we just had a micro daily original micro daily alone that improved both dizziness and as well as the balancing problem. And this work we did with Captain Hoffer, who was the captain of Navy at the time in Navy Medical Center in San Diego. And so I think if you take even if you just take a micro daily plus probiotics, you will be feeling better.
Okay. Well, thank you, Bruce.
How many times did it take it normal or
just twice? Oral or hydro does make difference. If you take hydro, 1 in the morning, 1 in the evening.
Just regular doses. You don't need to go on a heavy dose.
No.
Or suggest a heavy dose, Bruce.
Yes.
Okay.
Okay.
Thank you. And I'm glad we got the microphone and the camera working all together.
Yeah,
Yep.
Bruce.
Yep.
Yeah.
Yeah. And so Bruce, while you're on here, maybe you want to just let everybody know your quick experience. How many games did you referee this
Yeah,
last year at 88 years old?
Yes, he and
I
I.
did.
Yeah.
I did 25 games last season.
Wow.
25 basketball and soccer games, or just 25 basketball games?
Just basketball.
Wow, refereed 25 basketball games
Can you believe that?
at 88 years old. So
Yeah, we are
that's
And
the power of
and
these
in
products.
less than 40 days, I'll be stepping back on the floor for basketball.
good.
Wow, another season. You're gonna go into your 89th year, still refereeing basketball.
Yeah, we are of the same age group.
Yeah.
And I don't have a pain in my body.
Great.
Praise
I
God.
don't have. I have a little bit back pain because I used to play. You know, probably you play two sports, so I have a little bit back pain issue. But otherwise, mentally, physically, other part of the organ, I'm perfectly okay.
Okay.
All right.
Thank you, Bruce. Great questions. All right, so
Thank you.
You bet. We're going to go to Dr. Robert. She's got a question out of the chat.
Okay.
And if you're ready to go, Dr. Roberts, we'll
I'm
just pull you
ready.
up onto the screen, and you
Okay.
can make the reference the chat, the comment, and the questions. Go ahead.
All righty. A. Anthony Davis asked the question, is the micro daily hydro damaged by heat? Can it be had as a hot beverage for the micro daily?
Can you repeat the question?
Yes. So the question is this: can you take the Micro Daily Hydro and mix it with hot water and make a tea with it? Is it going to damage it?
No, not at all.
No, it's
any way
perfect.
you want.
I love doing it that way, particularly as the
Yeah.
seasons start to change. That the really tart lemon tea is awesome.
Yeah, like a lemon tea. Yeah. No, that's
And
what.
I'm so glad that you said that, Dr. Prasad, because I've been drinking it hot ever since you gave it to us. I use this with my collagen, and
Yes, collagen, same thing. I
yes,
use collagen like that. Yeah.
I heat them up and drink it, and I like it
Yeah.
pretty well.
They can keep
Somebody
you-
said, Dr. Prasad, Vicky said, if your next product is a hair growth formula, you will become a trillionaire. So think about it. And someone wants to know if, and I think that it would be great if we would come back to the last two after we get the other three, but this one is, do you suggest glutamine with your products to help out? And I don't, Vivian didn't make that clear enough.
Anything else. You don't take anything else.
Don't take anything else because yours is combined just right, correct?
That's right, exactly.
I CQF on your product make it just
many
right.
people say glutamine, but it has no specific function that our product cannot perform it.
Good. Glutamine,
of resource.
glutamine, that product does not need to be added to our product.
No.
Okay, very good. Jeff, let's take the last three, and then I have about three more over here that people want to say a little something. Okay.
All right. So Karen Jenkins, you are next. Karen, and then we've got A, BM, and Barb. So Karen, awesome. Thank you for turning on your camera. We'll add your spotlight. You'll just need to unmute your microphone. Go ahead. Your question for Dr. Prasad.
Okay, thank you, Dr. Prasad and everybody. I'm presently here at the Methodist Rehab in Jackson, Mississippi, with my oldest son, who has been on life support as in SICU. He had a terrible automobile accident. It was a rollover several times. And he has a brain injury. And my question is, what would be suggested for me to start him with He's in rehab now. He's come a long ways. He can open his eyes and recognize you and recognize people but he's not speaking. But today in rehab, he did take steps in walking. His legs are very strong. The only internal organ that was hurt was his liver. And they said that would grow back. But he has a T4 and 5, I think, in his neck that goes to his spine that they decide no surgery. He's had 2 surgeries on one arm, his arm and finger. So my question is, where do I start with the products?
Yeah, I think, I would say that, EMF hydro, in his case, I would say give 2 in the morning and 2 in the evening, at least for a couple of months.
Okay.
And that's very important. Also, for him, the omega-3 is also extremely important.
Okay.
But if omega-3 is very easy to take, but if you can't swallow it, nothing can be done for a while. And then you can also add brain boost. You can open the capsule and put in a hydro, and you can do that way. And
Okay.
and then of course, he's young, so he doesn't have a digestive problem, and
No.
so also he's young, so he would not have any problem of intestinal dysbiosis. But since he had an injury, you don't know what area I have an injury. But I would also suggest to give him the digestive enzyme, because of injury, he might have injured pancreas. You don't know, not severely, but doctor is correct, liver will regenerate, so you don't have to worry about liver, especially he's young. So really,
Yeah.
those 3 things that I would suggest to take care of that.
How many brain boosts, Dr. Prasad?
I think brain boost, I think I will take 1 in the morning, 1 in the evening.
Okay, 1 and 1. Okay, because myself, I've had 3 strokes. I had my 3rd stroke Christmas Eve 2022 last year. And so since January, I myself have been on the brain boost. I also take the hydro and the omega-3 and
Probiotics for you.
Yes, probiotics. I take the
And
probiotics.
now digestive enzyme.
And yes, and I also take the collagen.
Collagen, yeah. So you are taking everything that you need to.
I take, yes, sir. I'm
How
on
do
the
you
whole
feel?
works. I've been on your products since January. The 2nd week after I returned home from my hospitalization, because I had the brain boost, and I was told about it by Peggy and Freddie. So I've been on the product since January, and I thank you, and I'm doing wonderful. I appreciate it. I really do.
Thank you.
Wow, awesome. Thank you, Karen. And it's awesome to see that you're asking for help for others, particularly somebody
and
so
for your
close.
son, and let us know how he reacts after.
Let us know.
Yes, sir, I will. I will. Thank you.
For
You guys
Sister
need
Karen's
to know
son, would Dr. Prasad suggest
that's my
CBD?
homegirl there out of Mississippi, and we
That's
are
right.
That's exactly right, and we are so happy to have you here with us. Jeff, we are going to ABM.
Yep, that's the very next one. Thank you. All right, so ABM. I'm not sure if those are. Go ahead.
They're acronyms. That's just my names.
Okay.
Good night. Thanks for taking my question. Let me just ask. Good night, Dr. Prasad. Good night, everyone. All right. So yeah, I'm from Jamaica. So my question is, what do studies show on the long-term use of collagen peptides with enzyme inhibitors on the body? And within that question, I'd ask, how does it affect weight gain versus weight loss on the bones and cartilage?
Yeah, there has not been, most of the study that has been published in the literature has been a short term. Clinical study is never like 1 year or 2 years. The longest study was done with the collagen peptide was in combination with in cases of diabetes, where they follow for 1 year. And but collagen that we have with inhibitor, nobody has done a long-term study. And the only benefit of it is just a common sense that if you have just collagen peptide without the inhibitor, you will see some beneficial effects, but you have not inhibited the enzyme which are responsible for degrading the collagen. So newly formed collagen will be degraded quickly. But with the enzyme inhibitor, they will sustain it. An enzyme inhibitor that has been isolated from a amla extract and white tea extract, they are very non-toxic. There is no toxicity. Amla has been used in the Ayurvedic medicine for thousands of years. And so you don't have to be concerned about the toxicity issue. And so I think we feel that first, there has been no long-term study with our product, except what you guys, some of you are taking it, and one they report the benefit and no toxicity as yet. And though I don't expect any toxicity because it is a protein.
Okay. Okay, thank you.
30% of your total body protein is collagen. So that you don't expect any toxicity at all. And the sources of enzyme inhibitor also has no non-toxicity.
Very good questions. Thank you for coming on. And also to add to that, probiotics and the digestive has been very beneficial with people losing weight, getting the food broken down properly and
digested
then
properly,
carried.
and therefore it gets eliminated properly. Yeah.
Perfect. Yep. All right. So we have three left here quick, and we got 3 minutes. So Barb, Vivian, and C. Henry Johnson are the last 3 that we have. Barb, go ahead. Your microphone is open.
I want to know if I take some extra B vitamins and extra vitamin C, will that knock the micro daily EMF out of balance? Because I'm trying to deal with heavy duty varicose veins.
Yeah, I think if you take, for example, when you say vitamin B, right?
B complex.
B complex. See, sometimes, for example, especially vitamin B6, if you are taking a larger amount, that can cause what is called a peripheral neuropathy, means numbness of extremities. So we have sufficient amount of B vitamin. Therefore, I would not recommend taking any B complex.
Okay.
Especially if you're big, sometimes B complexes, like they will add 50 milligram of everything. I don't know the doses that you are taking, but the concern is that especially B6 has a higher level of B6 can cause nerve damage. Which is, yeah, so until I have a specific need that, I don't see, because we have sufficient amount, more than RDA amount of vitamin B in our formulation. Therefore, you don't need it. Same thing true for vitamin C. There is no reason for taking extra vitamin C. We have more than sufficient amount that your body needs to take extra vitamin C.
Oh, okay. All right. Okay, well, thank you.
Thank you.
Very good questions. And it's going to bring us almost right back to the very beginning with another question about what do you add? And it's like Dr. Roberts mentioned, as soon as she stepped away from all of the other stuff that she was doing, that's when her body really started to respond.
Yeah.
So thank you, Barb. Very good questions. All right. So Vivian and then C. Henry Johnson. Go ahead, Vivian. Vivian Longoria. There we go. Awesome. Yeah, and we get to see her. That's perfect. Go ahead.
Okay, so my question is, my friend just started showing me the product just literally yesterday. I am long-term COVID. I have oxygen. I got that in December 2021, and I'm trying hard as I can to get off this oxygen. What kind of how has it helped lung damage? Because I guess I have hypoxia and I think fibrosis or scarring of the, for sure scarring, because they've shown it in x-rays. And I'm supposed to go in November to start a COVID clinic for 8 weeks to see if there's any more improvement. I am not on any pharmaceutical medications whatsoever. I only take supplements, and in a year and a half, I have shown some improvements, but I'm trying to see if these micronutrients will increase my lung capacities.
I think several people have similar situation, and they reported to us beneficial effect in terms of a lung damage, and not only lung damage, but also neurological and other issues. Damage, especially lung, is especially susceptible to COVID-19. And the reason you are seeing this kind of damage because you have increased oxidative stress and inflammation. So my suggestion would be to take what we call our core 4, and also digestive enzyme that we recently developed it, and in your situations that should be plenty for the time being, and try for a month, and next month report, see how you feel in terms of breathing or oxygen need. Oxygen, once the lung gets repaired or prevent the further damage to the lung, then you will not need any oxygen, extra oxygen. And so it is just nobody has done a human study on this issue, but based on what happens to the lung after COVID infection and what these products can do it, I would suggest this will be useful for your health.
So you're saying core 4 and the digestive, how much would I take?
Core 4 just tells you just the preventive dose. For example, micro daily would be 1 in the morning, 1 in the evening. We always have twice a day type of phenomenon.
Okay, and include you said you have digestive enzymes as well?
Digestive enzyme, yeah. Anytime you have a meal, big meal, you take 15 minutes before a meal, is a digestive enzyme. And probiotics you can take anytime. And so these are very, very important because intestinal dysbiosis means increase in the number of harmful bacteria occurs as you grow older with and without disease. And in your case, you have some kind of health issue. So there would be intestinal dysbiosis. And one and only way you can correct them, you take a supplement that we have, probiotics with prebiotics.
Yeah, I also have fibromyalgia and Ehlers-Danlos system, which one affects my muscles, one affects the connective tissue.
Yeah.
So it's kind of like one, if it's not one hurting, it's the other.
Yeah, all are related to increased oxidative stress and inflammation in your body. And because you suffer COVID-19, which further, as you know, there is cytokine storms, which is an inflammatory reaction. And so you suffer more, but I'm glad you recovered it. And now the question is how to repair those damage, and providing a good micronutrient will help you to recover.
Okay. So I'm on the right path. Just continue to. I know, unfortunately, it's taken a lot longer than I wanted it to.
Yeah,
but
and don't take, many people advertise many things. Don't take any other things.
Okay, so just stay with your core and the digestive. And you said also possibly a probiotic, probiotic.
It's part of the core.
Oh,
that's part of the core.
Okay, I haven't had a chance to look at anything, but okay, and so I'll take it for a month and see what happens.
See, next month.
Come back on the fourth Wednesday and tell us how well you did, because on the fourth Wednesday we have a testimonial.
Yeah.
Okay.
So,
well, I'll
come
check
back.
the product then. Thank you so much.
Sure.
You bet. Welcome to the family. Thanks,
Thank
Vivian.
Welcome.
All righty. Okay. So, Dr. Prasad, our other one, Henry left. I don't know if he dropped out his signal or just what it was. Thank you for being.
No, Jeff, I'm still here.
Oh, there you go. Okay, I didn't see.
Let me
it.
bring my camera up too as well.
All right, perfect.
You might recognize me.
Oh, there we go. There we go. Yes, we do. We know you.
Good evening. Good evening.
How are you?
Doing well.
Great to have you here with us. So what's your question for Dr. Prasad?
A friend of mine I met today at the park, he has been experiencing severe back pain, and he's been diagnosed with arthritis in the spine. And I was going to give him some samples, but I said, let me chat with you all tonight and see what you would recommend to start him on right now.
Well, I mean, we always say, about the core 4 and digestive enzymes, and because that's arthritic lesions, and sometimes doctor recommends certain medications, some antibody against certain things, depending upon what kind of arthritis is, and so. Again, this is a good thing about our product. It does not interfere with the effectiveness of medication. And so if doctor recommends some other things to take, they can take it. At the same time, I would suggest take core 4 plus the digestive enzyme.
Okay, I will advise him of that tomorrow.
And then again, try for a month or 2, and then let us know if it feels any difference. And the idea is, do you feel any difference? Do you feel less pain?
Mm-hmm.
Because you cannot, at my age, you cannot remove 100%. But if you have a 50% reduction in pain, that's pretty good.
Sure. And Dr. Prasad, one other question. If you're taking the core 4, would you recommend taking other supplements as well, or
No.
just stick with the core 4?
I would not. Just take core 4 plus digestive enzyme.
Regardless of what your conditions are.
Because arthritis issue is there. There is no eye issue. Otherwise, I would recommend eye boost. There is no brain issue. Therefore, I don't recommend brain boost. And so, but if it is just the, arthritic lesion or some pain, those should be sufficient.
Okay, because personally, I don't have any health challenges, but I had been taking supplements prior to getting involved with Engage. And I've continued to take my products along with the core 4.
Yeah.
Don't need to.
It's not needed, but if you want to take it, it's up to you.
Okay.
You'll find a better result if you discontinue the use.
Yeah, because sometimes the people take extra these kind of things. I was a good example of B complexes, and but if somebody is taking some non-toxic issue, like I was taking about biotin or something extra, like if somebody is taking more, say for example, vitamin D, because we don't make too much vitamin D. So the couple of things I can say is okay to take extra, but not vitamin C, not vitamin E, not vitamin A, not any B vitamin, not zinc, not selenium. But only thing I recommend extra is vitamin D if you are if we want to. And that's about it. And then our provide sufficient amount of nutrition for your body to heal.
Great. Well, thank you. I'm going to try that for 90 days and see how I feel.
Exactly. Because nobody has done a clinical study on this. It is almost you are a guinea pig. But it is non-toxic. The worst thing would be it has no effect.
Okay, sure.
So
thank you, Dr. Prasad, and thank you, Jeff, also.
Thank you, and I appreciate it. You bet. Great
Well,
questions.
he was in Cancun with us.
He was.
Guys.
He was with us. Yeah.
I remember.
He just coming on board, and so we're excited about him being with us.
Yeah,
that's great. Great to meet other family members. He was hanging around with Preston. So
yes,
great times. Oh my goodness, where did the hour go? Dr. Prasad, you stuck around with us here for almost 10 minutes longer, and we really appreciate what you have shared with us tonight. Thank you, everybody.